Hello and welcome to Insights. I am Elizabeth Omori. Today on the program, two germane issues will be discussed. Firstly, Noma disease, swiftly advancing and often deadly infection affecting the mouth and face. Noma typically starts as a gum ulcer and quickly invades the jawbone, cheeks and surrounding soft tissues. This leads to extensive tissue death and can result in fatal sepsis. Those who survive are frequently left with profound facial deformities and may experience difficulties with breathing, swallowing, speaking, and even vision. In 2023, the World Health Organization recognized Noma disease as a neglected tropical disease. Some experts will be educating us on this disease, and you wouldn't want to miss their segments. Now, disability inclusion is another issue. This aims to foster inclusive societies that value diversity and provide equal opportunities for persons living with disabilities. Caregivers believe enlightening the public about disability issues and rights will build a sense of belonging. So, how do we work together to create a more inclusive and equitable world? When you stay glued, you'll find out. Once again, welcome to Insights.
Whatever the issues are,
the National Assembly is constitutionally empowered to scrutinize,
however complex or intricate.
We have involved all the academia, the members of the academia. We have involved the academies.
Be it government policies or in fact any issue of public concern.
Our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of grievance in terms of who has been in power longest and who becomes the governor of the state.
it's also in the quality of food being consumed.
After all, perception is insight.
And gaining understanding is also getting insight.
Noma disease is a rapidly progressive infection of the mouth and face that primarily affects malnourished children living in extreme poverty. It causes the destruction of soft tissue, muscle and bone, leading to severe facial disfigurement and high mortality if not treated early. On this segment, we will be educating Nigerians on this disease. My guest, Dr. Abubakar Abdullahi Bello, Chief Medical Director, Noma Children's Hospital, Sokoto, and Dr. Charles Onono, Medical Director, Noma Center, Abuja. They will be educating us. Gentlemen, thank you so much for joining us on Insights.
Thank you. Thank you for having me.
Thank you so much.
Good afternoon.
Dr. Onono will allow me to start this conversation with Dr. Abubakar, and that's because his portfolio speaks to children with our focus. Dr. Abubakar, please enlighten us on this disease.
Thank you for having me on this program. Noma disease, as we all know, the name Noma, it does not mean famine like Hausa used to call it, but rather is a particular disease that affects children between the ages of 2 to 7. It causes the rapid destruction of soft tissues of mouth and leading to rapid destruction. It destroyed the soft tissues within the 2 weeks of onset if not receive any form of treatment. And we, as the two centers, the one that we have in Sokoto as Noma Children's Hospital Sokoto, and the one that we have here in Abuja, are primarily meant for management and free treatment of these particular cases. The treatment is free of charge, and there are risk factors that we need to know about this particular disease. Noma prevalence is not only in Sokoto. There was some documentation that we have Noma even in the West Africa, in the Europes, but they are able to eradicate Noma there. But we have Noma cases in the sub-Saharan Africa, and Nigeria happens to be one of the sub-Saharan country. And the prevalence of Noma cases are mostly in the northern part of the country. And Sokoto, so to say, we have a lot of cases of Noma reported to the facility where they receive treatment.
Okay. All right, Dr. Noniwu, I would like to ask you, what are the causes of this disease and its symptoms?
Okay, thank you for having me. Yeah, actually the major cause of the disease is not fully known, but there are things we call predisposing factors. That's things that once you have them in the background will actually, make the onset of the disease there. So some of these predisposing factors include, number one is poverty.
Okay.
Poverty is a major problem, malnutrition, and poor oral hygiene. And then we also have childhood diseases like measles, malaria, pneumonia, any of these diseases that can cause decrease in immunity of the children. And also we also have something like HIV and any other thing that can cause depressed immunity in these children. The symptoms, basically, when it starts, it just starts like a small swelling in the gum, starts painful swelling in the gum that starts, and gradually, within 1 to 2 weeks, it does the destruction it has to do if not treated. And of course, when you see a child crying and crying in pains without, and most likely pointing to the mouth, it requires immediate attention. This swelling is also associated with pain, associated with bad odor, bad mouth odor, and then gradually there will now be swelling, and the swelling now will increase, leading to sloughing off. We call it ulceration, but in a layman's term, sloughing off of tissue that it has destroyed. It can affect the mouth, the lip, the bone, and in some cases it extends to the nose, and quite a number of times the eye.
Okay, so are there common symptoms a nursing mother can look out for her to understand that, oh, this child has this condition?
Yeah.
Okay.
Basically, if the child is crying, because the child may not be able to tell you, I have swelling in my mouth, because it usually affects mainly children. The child is crying and there is, salivation, excessive salivation.
Okay.
Okay. And if the child, about 2 years, might be able to point to the mouth, and point to the mouth and tell the mother. So the mother will look out for, is there any swelling in the gum? Is there any ulceration? Ulceration is like a wound in the gum. If there is wound or ulceration in the gum and there is excessive salivation and then there is bad mouth odor, please, that mother should go to the next health facility and report there for immediate treatment.
Okay, I think you just hit the nail. Dr. Abdullahi, we understand that children are at high risk. And I'm asking because you deal with children. Who else could be at risk?
It can also affect adults.
Okay.
Yes, but it's very, very common among the children between the ages of 2 to 7. But that does not mean adults cannot come down with Noma. And like you mentioned, some of the risk factors that will make an adult to come down with Noma, those with HIV, some immunodepressive conditions like HIV, something that will depress some disease that can depress the immunity like HIV, tuberculosis, can put an adult at risk of coming down with Noma, coupled with other risk factors like poor oral hygiene and malnutrition.
Okay, so when a patient presents late, could this be reversed?
Actually, late presentation is what we are fighting for, that we need to identify this particular disease in early stage because it has some stages. Like we know it has a stage 0, stage 1, stage 2, stage 3, stage 4, and 5. Yes, we don't want patient to present in the hospital with stage 3 disease because at stage 3 already this destruction has already happened and there is no reversible cure because the soft tissues are already gone, the muscles and the bones are already gone. But we can arrest this particular disease in early stage, and that's why we are advocating and we are calling for early detection, and we are campaigning for early detection of this particular disease. Let's see how we can identify this particular disease as zero stage, because if you don't identify it as zero stage, it will progress to stage 1, and if you don't identify it as stage 1, it will also progress to stage 2. And this destruction happened within 2 weeks. So it's very important for us to identify this particular disease in its early stage.
In its early stage.
Yes.
Now, Dr. Ananiho, is surgery the only treatment for this disease?
Okay, when the disease is at stages 1, 2, the patient is treated with antibiotics.
Okay.
Okay, with good antibiotics and proper feeding, because most of them are malnourished. This stage will be reversed. By the time it gets to stage 3, where we have massive destruction of tissues, mucosa, muscle, bone, and all that, now that's where surgery comes in.
Okay.
And the surgery comes depending on the degree of destruction. Some of it, if it is small, then the surgery required is small. Okay. But if the destruction is big, then the surgery required is complex and will take multi-stage surgery before that phase is put together.
So what are the epidemiology and global efforts in place in addressing this disease?
Okay, there has been, Noma has been enlisted as a neglected tropical disease, and this brings it to the front burner in WHO's view. And this more or less helps in bringing more players into the management, control and management of Noma. It's a disease that affects mainly, sub-Saharan Africa. That's where we have greatest burden. And of course, we have Southeast Asia. We don't have it in Europe. We don't have it in America, although they used to have it. And the direction is to try as much as possible to prevent it.
Okay.
If it can be prevented in Europe, right now they no longer have it. They used to have it before, but now they no longer have it. Okay. And what did they do? Basically, education, very, very important. Improved lifestyle, very, very important. Malnutrition is more or less a thing of the past out there. So if some of these basic predisposing factors are taken care of, we believe that also in our own climate here in Nigeria, this will be addressed.
Dr. Abubakar, I'm coming to you now.
Okay.
So Dr. Abubakar, tell us, what has your center been doing to ensure that this disease is eliminated before 2030? That's a target, an SDG target. And then if we are to look at the roadmap, the WHO roadmap on neglected tropical diseases, what is your center doing?
We have the support of the government and the partners. We work with MSF as an organization in the facility since 2014. And sincerely speaking, we organize a lot of advocacy and campaign where we enlighten the public on how to prevent and how to detect this particular disease. We have trained a lot of health workers, not only in Sokoto, but all over the nation, Kano, Maiduguri, and some part of the country also. We've trained a lot of health workers on early detection and how to identify this particular disease early. And also the surgical component also, we are doing a lot with MSF to see how we can restore dignity to some of these patients affected by Noma.
By Noma. All right, Dr. Noniho, what is your center doing as well? I want your thoughts on that. And how many surgeries are carried out annually? We've
been engaging ourselves in quite a number of things in creating awareness around the country. We have worked together with Ministry of Health. We've been to about 5 different states also training healthcare workers, community mobilizers, and even native doctors, because this is very, very important to us, especially the native doctors, because most of the time they are the ones that the patients run to first. So we try to train them and tell them the importance of sending this patient to us as early as possible. And with that, we have attracted patients. Most of them come very, very malnourished. Most of them, quite a number of them come with kwashiorkor, frank kwashiorkor. And when they come like that, you are not going to just carry them and start repairing the defect that they have. First, we have to, try and control the disease by giving them, very good antibiotics, and then, of course, nutritional rehabilitation, very, very key. We do that for about 6 weeks. And once we are sure that they are now ready for surgery, then we'll embark on the surgery. And for the past 2 years, we have done about 237 surgeries, and quite a number of them complicated surgeries. Some of the surgeries, like for one patient, may last for about 8-9 hours for the very, very complicated cases. Some of them will require, the ones that have just minor destruction or minor defects, they just undergo just one surgery and they go home. But quite a large number of them that we have seen will require several surgeries, 1, 2, 3, 4, or more surgeries before you can bring their faces back to shape. And of course, the surgeries are all free of charge.
That's very hopeful for anyone with a child with that condition. But still on surgery, are they really successful? How many surgeries do you have yearly?
We started 2 years ago. The first year, we did about 70 surgeries.
Okay.
And we had very, very good success rate. At least we should have over 95% success rate. Of course, few of them, had like wound breakdown, but of course we managed it. And then the following year, we had about 160 something, totaling about 237 surgeries that we have done for these patients. And I'm glad to say that we've not lost any patients.
Dr. Abubakar,
Yes.
Back to you.
Yes.
Let's talk more on the children. How do we engage traditional rulers, religious leaders, and then some that do not believe in going to the hospital?
Yes, quite all right is challenging, but we have done a lot. Yes, trying to educate the traditional rulers and the traditional herbalists in the community. As we all know, people in the rural area are mostly affected, and whenever in our own culture, any swelling in any part of the body, we tend to attribute it to be more of spiritual. And before you know it, our people goes to the traditional herbalist. And I mentioned that this destruction is rapid, and within 2 weeks it causes the destruction. And mortality rate for Noma is 90% mortality rate, meaning that 9 out of 10 children will die if affected with Noma and not receive any form of treatment within 2 weeks.
Let's talk about cancer patient. For example, a patient with ulcer, mouth ulcer. How is this handled?
Okay. Let me give you an example. We had a patient that came with us with Noma disease. And when we did our test, because we run baseline tests for all of them once they come in our laboratory there, we now found out it wasn't detected from the referral hospital. We now found out the patient has cancer of the blood, leukemia. Oh. Okay. And what we did was that, of course, you have to manage that before you start doing any surgeries for that kind of patient. And that was what we did. We, together with National Hospital, tried to manage the patient. So basically, if we have a patient with cancer, because I think that's the only patient that we have had so far with cancer, it will be a multidisciplinary approach, because you bring other people that are also involved in taking care of this. And Once that is brought under control, then we can do our surgery, we can do our aesthetic repairs and reconstruction of the face.
Of the face. All right, Dr. Abubakar Abdullahi Bello, CMD, Noma Children Hospital, Sokoto, and Dr. Charles Ononewu, Medical Director, Noma Center, Abuja. I want to thank you so much for joining us on Inside this week, and thank you so much for enlightening Nigerians on this disease. Thank you very much.
Thank you for having us.
Thank you.
Thank you.
All right, to conclude on this discussion is Dr. Abdul Ali, Deputy Medical Coordinator, MSF. Doctor, thank you so much for joining us on Insights.
Thank you.
Thank you. Now tell us, what efforts has your organization been making to ensure that the prevalence of Noma is reduced to the barest in Africa and Nigeria?
MSF has been in Sokoto supporting Noma Children Hospital to treat the patients, as well as work together with communities for awareness and early detection of cases, and so that they are identified in the early stage of the disease and referred to the hospital for treatment. We do have community work. We work community. We work to make the communities aware of what is Noma and how is it prevented, and then the treatment. We understand that Noma is a preventable disease, and in this regard we work through our outreach teams to reach to the community and work together with the community, educate them, and provide the needed support in this regard.
Okay, so are there challenges you face trying to meet up with the target of a particular project in reducing the prevalence, the burden on patients and their parents or family members? Are there challenges you face?
Of course, Noma is not a disease of one causing factor. It has multidimensional factors. Okay. It has it needs like a multi-factorial response as well. It's not only a disease of a microbacterium, but there are several other risk factors. In order to respond and treat this disease or eradicate this disease, we need to respond from different dimensions, from different factors, including nutrition. Nutrition is very prevalent in those patients who are getting Noma, and as well as the vaccination coverage. These are the two main factors that need to be responded and that need to be provided to the communities, so that they, other factors are the hygienes and their environmental factors that affect the Noma patients. There are several challenges. Some, unawareness of the communities about the disease. Sometimes the disease is so rapidly progressive that it takes just few weeks to reach to very dangerous stage. So for this reason, the awareness of the communities is so important, so that they directly seek the treatment, the care, other than going to traditional healers, where the treatment is delayed a lot, and then when they reach to us in a very advanced stage, where the treatment of those patients become very difficult.
Okay. Now, since you have been working with the Sokoto State government, I would like to ask you this. What is the level of response like? If you are to assess the level of response from the Nigerian government to addressing this particular disease, how would you rate the response?
For example, malnutrition is very prevalent in the area. So In order to treat and effectively respond to Noma disease, you need to work for nutrition as well. Vaccination coverage is very low in those areas because some people, I mean, like there is very low acceptance of vaccination in the area. So those are the areas where we need to work more on the vaccination coverage, nutrition, and most importantly, awareness of the communities about the disease and its preventing factors and the risk factors associated with this disease.
Okay, now let's talk about the WHO, World Health Organization's roadmap 2021 to 2030 on neglected tropical diseases. Now, Noma is one of them. Do you see us using the targets of this roadmap to see to the fact that Noma and other tropical neglected tropical diseases can be eliminated before 2030? Is that feasible?
I think it needs like more collaborative efforts from different organizations, educating communities, the awareness, vaccination coverage, nutrition. In this stage, even in the well-educated communities, let's say in the medical practitioners, the knowledge about Noma is very limited. So that is the work being done. Since this disease has come in the NTD, the neglected tropical disease list, the attention to this disease has increased. But I am very optimistic that much work can be done in this regard to at least have more people know about the disease, about the risk factors that is communicated with the community, and the community is empowered and the community know about the disease, how to prevent, and then if some people and some children they get the disease, how to treat, and they seek the appropriate health facility.
Okay, all right. Now let's talk about Europe. What exactly is that continent doing that the African continent is not doing?
There are some risk factors associated with this disease. It is not only a disease of one cause. It has several. Low vaccination coverage is one of that. Malnutrition is another of that causes. So I don't see, I mean, like these are the most probable causes that if you compare Africa or especially Nigeria with European societies, as well as the vaccination coverage. And other hygiene practices, for example, or the oral hygiene practices that is more correlated, that's more related to also poverty and access to hygiene material, for example. So these might be the causes, but there might be several other causes, but I can say these few of them.
Okay, so in reducing the prevalence of Noma disease in Nigeria, what is the role of the primary health care?
I think we see significant role of the primary health care in this regard, because primary health care is provided in the communities, and so the first role is educating the communities.
Okay.
Yeah. The second one is access to health care. These are the two major things that can be that I can say that the primary health care can have a very significant role in it. Once the first point of the patient or the caretaker is the primary health care where they can reach. And then if some patients they need secondary health care or even tertiary health care, they can be referred, they can be sent to other secondary healthcare hospitals.
Dr. Abdul Ali, Deputy Medical Coordinator, MSF, I want to thank you for joining us on Insight, and thank you for your thoughts on our focus. Thank you very much.
Thank you very much.
Whatever the issues are,
The National Assembly is constitutionally empowered to scrutinize.
However complex or intricate,
We have involved all the academia, the members of the academia. We have involved the academies.
be it government policies or in fact any issue of public concern,
our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of aggrievance in terms of who has been in power longest and who becomes the governor of the state.
It's also in the quality of food being consumed.
After all, perception is insight.
and gaining understanding is also getting insight.
The campaign for an inclusive society for persons living with disabilities aims to promote their rights and well-being, raise awareness about challenges they face, and encourage inclusive societies. Fostering disability inclusivity to advance social progress is a focus on this segment. And Bilkisu Schreiber, Communications, Learning and Documentation Lead, UNAPID, will speak to us. Bilkisu, thank you so much for joining us on Insights.
Thank you for having me.
And thank you for what you do for the disability community. Thank you very much.
Thank you.
Now, the campaign for inclusion is a global goal. Now, as an advocate for persons living with disabilities, would you say the campaign is achieving its desired goals?
Okay, thank you. Fostering inclusive societies for persons with disabilities is non-negotiable, because if you look at the population, we have 36 million people in Nigeria, so these are not people that you can ignore. So these campaigns are very important in order to ensure that the rights of persons with disabilities are advanced and they are fully integrated into the society. So inclusion is non-negotiable.
Inclusion is not negotiable. Now, what are the challenges facing the disability community?
That's an interesting question. So, although, like we said yesterday, the disability law was signed in 2019, but it has only been domesticated in 28 states out of 36 in Nigeria. Now, the main challenges include accessibility. First of all, implementation of the law. The law exists, but it is not being properly implemented. So implementation of the law is very, very important. That's one of the challenges that we're facing in the community. Accessibility, that's a huge challenge in terms of infrastructure, buildings. For instance, when somebody wants to go to a bank, for instance, and then they have a wheelchair and they cannot go in, or I have a meeting in somewhere and I need to use my wheelchair, but I'm not able to go in, that barrier now becomes what has brought about the big challenge, because according to the United Nations Convention on the Rights of Persons with Disabilities, a disability results mostly from that barrier that exists. The person has an impairment. It could be either a physical impairment or a hearing impairment, or but because of that barrier that hinders their full and effective participation in society, then we now have these disabilities. So accessibility issues, again, education, employment, inclusive employment for persons with disabilities. The law already says that 5% quota should be allocated to persons with disabilities, but there are still issues around stigma. And these issues are multifaceted, even from the communities. Sometimes they are discriminated against. A person's impairment does not mean that they are not able to contribute effectively to the society. Just because, sometimes disabilities are even acquired later in life. So it doesn't mean that my brain is not functioning, for instance, just because I'm a wheelchair user, or because I cannot see, it doesn't mean that I cannot use my other senses. So it's discrimination, against persons with disabilities, stigma, stereotyping, name calling, You know, that is a serious issue. Sometimes you hear derogatory terminologies being used to describe persons with disabilities. That is a serious issue beyond the accessibility. So we need a lot of mindset shifting. You know, people need to realize that persons with disabilities are humans too, and they have equal rights as every other person.
Okay. Now, before we talk about efforts and interventions of government or a non-governmental organization to making life comfortable for them, we would like you to share with us, have you ever had an experience of somebody, let's say, with visual impairment that is on a wheelchair or cannot hear, or with a hearing impairment, and this person is having multiple challenges? How do you handle such a person to fit in to any intervention?
Okay, thank you. So this question points to reasonable accommodation. What the problem is not that a person has an impairment. The problem is that the system is not accommodating them. So if we consider, for instance, a person that has that is a wheelchair user, if the building is accessible, they will be able to go in. Now, for a visually impaired person, let me use an example. Maybe we're reviewing a story, you know, and then we have hard copies of the story, and then there are other people who are able to see. But for a person that has a visual impairment, maybe blindness, if you give them an accessible copy, like in Braille format, they would be able to participate. Then in this case, and then sometimes there are also technologies like screen readers that enable persons with visual impairments, blindness, to be able to participate. If it is low vision, you can use large prints. So it depends on the kind of impairment. So if a person is hearing impaired and they are deaf, they communicate using a sign language interpreter. So there are different levels of accommodations that can be made for different kinds of impairments so that they can participate effectively. Abuse is a problem, you know, so there is safeguarding. We have several interventions. So there is the safeguarding. There are several pathways. When there's an issue of abuse, it's now affecting somebody's rights, and that is a legal issue. It is important to understand what are their needs, because you know, somebody might need a crutch to move around. Some other person might need a wheelchair. So it is important to find out what makes them comfortable. So for one person might prefer to use crutches to move around. Another person might prefer to use a wheelchair. So it depends. So it depends on what makes the person comfortable. So you cannot provide an intervention for someone without the person's involvement. So you need to engage them and find out what they need to be able to fully and effectively participate. Yes, even if a woman has a physical impairment, she can live her normal life. She can get married, she can have children, and she is to be protected from every form of abuse.
Okay. No, go ahead.
So yes, if there are cases of women with disabilities being abused, the laws are there. The laws are in place. Their rights are supposed to be protected like every other person without a disability.
Okay. Now, talking about dignity, protection of their dignity and their rights, let's take cues from the National Human Rights Commission. Do you relate with them to ensure that these members of the society, of our population, receive justice when their rights are infringed on?
Yes. Okay. We relate with every right holder, you know, and we take all the necessary steps when there's an issue in terms of, because that is what we're about, right? Advancing the rights of persons with disabilities. So we take all the steps that are necessary to ensure and relate with all the appropriate organizations that ensure that rights of persons with disabilities are maintained and protected in the society.
Now let's talk intervention. You know, there are several interventions by the federal government to ensure that this segment of the population are comfortable in their spaces. Are they truly taking advantage, or are they leveraging these interventions?
Yes, of course. I mean, even beyond...
Like the social safety nets.
So yes, you know, the community of persons with disabilities, they're a very resilient community, you know, and then we're always, when there are opportunities, yes, we key in on those opportunities, even beyond the government interventions. There are several other programs, you know, like the We Can Work program, that is being implemented, and that's focused on providing access to dignified and fulfilling work for young women and men with disabilities, and it's being implemented across 7 African countries. So in Nigeria, JONAPAID is implementing, and you see, when we mobilize and these young women and men are taking part in this, you see the resilience. You see that they are willing to learn. You see that a lot of persons with disabilities are doing so well for themselves. So it is yes, persons with disabilities are willing to work. The problem is the work available? Is the government providing work for them? The policies are there, right? But are we implementing? Are we ensuring that we are maintaining, reserving that spot for persons with disabilities? Are we ensuring that their voices are being heard and that their contributions are being taken?
That's interesting, and that's a very big question to answer. Now, talking about what is expected of this segment of society, but really, how can they be fully captured in all sectors? Let's take, for example, during elections. Like for those with visual impairment, they still have issues with brailles. Brailles are not provided. For those on the wheelchair, some of them can't even get to their polling units to perform their obligation as a citizen. So how can they be fully captured in all sectors for full representation and inclusion?
Thank you so much for that question. You know, these 36 million people are not a population to be ignored, right? Okay. So for the elections, depending on the impairment category, it is very important that at the planning stage, we try to look at the different levels of impairments and see what are the adjustments or the minor amendments that we need to make so that this particular, each category is going to be able to be fully included in the process. For instance, for visually impaired persons, we have screen readers, you know. It is to now plan, like I said, look at what are the barriers, right? What is our current process? What technologies exist? How can we now leverage these existing technologies to ensure that depending on the person's impairments, we are able to also include them in every process.
Inclusion is key. Now, you know, the National Commission for Persons Living with Disability is also strengthening advocacy to ensure that persons living with disabilities are fully captured in all sectors. Now, let's talk about your own organization. How are you heightening advocacy?
Okay, thank you. So the vision is to ensure that equality, social justice is guaranteed for all persons. So we do that through advocacies, we do that through collaborations, you know, we do that through capacity building. So we are implementing several programs right now, partnering with different organizations, you know, to ensure that there is progress in the community of persons with disabilities. So a lot of work is ongoing, a lot of programs are being implemented, advocacies are ongoing, and yes, these are some of the things we're doing as JONAPAID to advance the rights of persons with disabilities.
Okay. Now, for those in the rural areas, how do you reach them? How do you include them in your own register to ensure that they benefit from any initiative?
Oh, that's an interesting question. You know, now we have state chairpersons, you know, and then for each state we also have, you know, there are 774 local governments in Nigeria, and JONAPAID is present everywhere. So, you know, it is like the federal system where we have, from the grassroots level, we have our representatives there. It's an organized association. We have the state chairpersons, and then they also mobilize from the different communities as well. So there's that synergy. And when we have an intervention in a particular location, it's important to go through the leadership. You know, so if it is in the state, yes, go through that state, and then if it's in the community, who is the lead of that community? So it is really an organized system, and so we go through the different channels, the appropriate channels, to ensure that it is. So it is really not a problem to capture persons in the urban areas, in rural areas. We have many programs. We support many programs in mobilization, especially even in the rural areas. It is really not a problem because our roots are there. We have roots, and we have the synergy to be able to organize ourselves.
All right. Okay, now one of my last questions is actually this. You know, being physically challenged or living with a disability, the feeling could be best described by somebody who is experiencing that challenge. How do we change the narrative?
Thank you so much. You know, that is really crucial issue. I think the key would be empathy.
Okay.
You know, so do not view, now we have moved from, there are different ways of viewing disability, and we do not want people to view disability from the perspective of the charity, or, you know, people that need help, or people that are sick. You know, that is why we're moving to the rights-based model. And in this case, it is to see that no matter how a person looks, and I think we can take this from the home, you know, from the families to the communities to our different organizations. From the home front, we should lay a foundation that no matter how a person looks, or no matter the fact that a person is different does not make them any less of a person. So I think empathy is very important, because nobody wants to have a disability.
At all.
Sometimes people fall sick, you know, it could be as a result of an accident. Let me share a personal experience. When I was in the university, like in 200 level, I realized that I couldn't see the board very clearly. So I would always sit in front to be able to see. Then when I got to the third year of the university, we were having our classes in a large lecture theater, and the board was far, I couldn't see. So I had to depend on writing from my friends. And there was this particular class, it was during statistics and research, it was mathematics, and the lecturer was solving on the board, and I couldn't follow. I was so frustrated. I couldn't see, and the person that was sitting beside me was not writing. I couldn't follow. I cried. It was so painful. Now imagine, what did I do to contribute to that situation? And then there were also instances where people that I know would be from afar, and they'll think that I'm just trying to ignore them. Meanwhile, I did not even see them, because I can't see them from afar. So it was from that class I went straight to the clinic, then realized I had short-sightedness. Did I contribute to that? Did I choose to have it? Now, when a person has an impairment, we need to understand that nobody chooses to have an impairment.
Yes.
We need to, so one thing that is key is respect. Respect is key. We need to respect everyone, whether it is a young person, old person, male or female. Everybody deserves respect, regardless of how they look, regardless of how they are, regardless of their capabilities, whether they have a disability or not. I think it is really important that we emphasize respect in the society, and empathy. You know, give people room. You know, sometimes they say don't judge a book by its cover. I'm working with a lot of persons with disabilities. There are different levels of impairment, yes. And you would be amazed at the talent that we come across, that we interact with, that we work with. So it is a mindset thing. There's a lot of mindset shifting that needs to happen, starting from even how we address our fellow persons. You know, it's very important. So I would say empathy, respect, and awareness. We need to intentionally learn how to, you know, interact with the people that we live with. You don't see results overnight, but you know, especially from the We Can Work program, there is this youth focus. You know, the focus is on ensuring that youth are effectively integrated in the society. And thankfully, for this leadership, you know, they understand, this leadership of JUNAPID currently understands that youth are the future. Yes. So it is a youth-focused campaign, and we are seeing a lot of solutions being provided by young persons with disabilities. For instance, one person thinks that she thinks she would prefer a solution if she could redesign the world to make it inclusive for everyone. She would prefer that all school curriculums have sign language integrated. So imagine everybody in school they learn to communicate in sign language. That means whether a person is hearing impaired, you know, they would not have issues communicating. And that, if we are able to do that, that is one step. One of the things that we want to see is that all national budgets are disability inclusive. Because sometimes you need also tweaks, mindset shifting, you also need the resources to be able to, you know, achieve some of these things. Yeah.
Bilkisu Shaibu, I want to thank you so much for joining us on Insight, and thank you for what you do again for the disability community. Thank you very much.
Thank you for having me. Thank you so much for having me.
Whatever the issues are,
The National Assembly is constitutionally empowered to scrutinize.
however complex or intricate.
We have involved all the academia, the members of the academia. We have involved the academies.
be it government policies or in fact any issue of public concern,
Our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of aggrievance in terms of who has been in power longest and who becomes the governor of the state.
It's also in the quality of food being consumed.
After all, perception is insight.
and gaining understanding is also getting insight.
And that's Insight today. Thank you so much for watching. Prioritize your health. Shun acts capable of hurting others. Love more. Be your brother's keeper. We'll see you next week. Bye for now.